What's going on, guys? Tony Maritato here, physical therapist and owner of Total Therapy Solutions. So I want to talk to you today about treating the soft tissue injuries and pain that are sustained during your knee replacement that people aren't really talking about enough. Now, you're probably looking at my necklace, my bling. I'm going to use this as an example later in the video, so keep watching. If you're not subscribed to the YouTube channel, take a minute, subscribe while I'm talking, ring the notification bell so you get notified when I post new videos. My goal is to get more new videos, weekly videos out here so I can answer your questions, and people having total knee replacements in the future have a resource to find the answers and the information they've been looking for. So let's get back into the topic. A lot of patients, one of the posts recently in our Facebook group was relating to thigh and calf pain being more intense and more problematic than the pain from the knee. And I can tell you that over the last 2.5, 3 years, I've seen this as a growing trend. Now, I think we can figure out the upper thigh pain. Part of the problem with that is the tourniquet that's used during surgery. Not all procedures, but many times there's a tourniquet placed around the upper thigh. The tourniquet is there to reduce blood flow, to reduce blood loss during the surgery. Okay, the problem is the unintended consequence of tissue damage due to the tourniquet itself. And the bruising, the swelling, the pain due to the tourniquet that I don't think patients are adequately prepared for. Now, a secondary problem is the pain that patients are describing in the calf muscle itself. I can't say that I have a solution or an explanation for what is causing that, but I can tell you that more than one patient over the last couple years has come in and told me that the pain in the calf is so intense, it limits their ability to move their ankle, dorsiflex and plantar flex, and is probably more of a limiting factor to them walking than the actual pain and the limitation in range of motion at the knee. So what can you do about it? What can you do to reduce or resolve the pain in the calf and the thigh while you're rehabbing the total knee replacement? The first thing is try to determine what you think is causing the pain. If you believe it is muscular in nature. When we're looking at what we call soft tissue, we're talking about muscle, we're talking about fascia, which is a kind of connective tissue, perhaps ligaments or tendons, in this case the iliotibial band. It's a thick band of connective tissue that runs from the hip along the lateral thigh down to the front of the knee. Any of these structures could be damaged while the tourniquet is in place. But like any soft tissue injury, these injuries typically heal quickly. They have a rich blood supply, and they can be addressed. My favorite way of addressing this kind of discomfort, pain, is with a form of self-massage. Now, if you've seen any of my other videos, you know I'm a big advocate for rolling pin massage. You can use a standard wooden rolling pin. You could use metal or marble. You can use some of the new cryotherapy rolling pins they're selling on Amazon. I'll post a link to those products in the description below. But basically, you use the rolling pin to massage the muscles, the tendons, the ligaments. You massage the connective tissue, the fascia, to try to facilitate fluid exchange. But you're also spreading that connective tissue. You know, the reason why I wore this today was because one of my examples that I share with my patients in the clinic is, just imagine there was a section within the muscle. We commonly refer to it as a knot. It's not a knot, but I'm going to use that language anyway. So if I took a string, right? Muscles are like strings. They're like rubber bands. They can only pull. They can't push. If I tie a knot in this string, now if I try to stretch that by pulling the ends apart, what's going to happen? It's not going to go away. It's just going to get tighter. The nervous system is trying to protect the musculature. And so when you try to pull against a muscle that's tight because of the nervous system or because of scar tissue or other factors, it's just going to resist. Now, however, if I go to where that knot is and I specifically untie it, what that does is it allows me to essentially deactivate the nervous system, turn down the protective mechanism, spread the tissue, facilitate that fluid exchange. You know, I used to say get the waste products out, whatever you want to think of it as, but basically what you're doing is you're bringing nutrients into the tissue, you're taking away the waste products, you're helping the lymphatic system do its job a little better. These are the factors that go into soft tissue healing, and anytime you can facilitate or improve soft tissue healing, that muscle type tendon ligament pain is going to be reduced at the minimum, go away ideally. And so the same treatment strategy can be used for the calf muscle, the lower leg, below the knee. You would use that same rolling pin, you'd bend over, you'd massage the calf muscle. I like to start massaging the thigh to allow the fluid in the thigh to move into the system and get cleared by the kidneys. Then I would go down to the calf muscle, and you're always applying the pressure primarily from low to high because we want that fluid to come back into the circulatory system and get processed through the kidneys, get the junk out, facilitate fluid exchange, improve healing. Does that make sense? I hope it does. So the sensitivity around the thigh and the calf is a very common symptom. We believe the thigh is because of the tourniquet, the calf is, we don't know why. But we know that it will interfere with the rehabilitation and the recovery of your knee. We know that will interfere with your ability to sleep well and feel well. And so the faster you can eliminate those soft tissue symptoms secondary to the surgery, the faster you can get back on your feet, get back to doing the things you love, and get back to doing the stuff that you wanted to do, which is the reason why you had the knee replacement in the first place. Guys, I hope this video was helpful. If it was, please let me know in the comments on YouTube. If you have more questions, post them in the YouTube comments. YouTube is the best platform for you to communicate what you want to know more about with me, because if I can answer your questions there, more people around the country and even around the world would be able to see this video and get answers to their questions also. Guys, as always, I appreciate your time. I appreciate your effort. Keep up the good fight. Keep doing what you're doing. You're doing it right, whether it's happening fast or slow. Just understand you're doing the right thing, and I'll catch you guys in the next video. Thanks for watching.